embark on an intellectual expedition tracing how Sigmund Freud, a struggling neurologist in 1885, revolutionized our understanding of the human mind. This isn't just history, it's about understanding why Freud remains psychology's most controversial yet indispensable figure in 2025. Before we dive in, let's ask ourselves a few key questions that will guide our exploration. 1. Why does Freud's name still echo through every psychology and psychiatry textbook more than a century later? 2. What pivotal moments in his early career set the stage for the birth of psychoanalysis? 3. How did the scientific and cultural landscape of Europe shape Freud's revolutionary ideas? 4. There is a phenomenon called hysteria. Was Freud's idea correct after 140 years? This isn't just a history lesson, it's a deep dive into the making of a theory that would forever change how we understand the human mind. So, let's begin. The unavoidable Freud, why he still matters. Whether you're training to become a psychiatrist, a clinical psychologist, or simply studying human behavior, one name is impossible to avoid: Sigmund Freud. Open any textbook, examine any case study, and you'll find Freud's fingerprints all over the historical introduction. Freud's work is vast, spanning over 5,000 pages across 24 volumes, and his legacy is complex. But here's the thing, understanding Freud isn't just about memorizing theories. It's about tracing the evolution of modern psychotherapy, from the rigid biological models of the 1880s to the dynamic, talking-based therapies we know today. So, in this series, which may take us a year or more to complete, we'll do more than just summarize Freud's ideas. We'll read his original works, examine his influences, and even explore the cultural and political backdrop of Europe during his time. Because to truly grasp psychoanalysis, we need to see it as Freud did, not just a theory, but a product of its time. October 1885, the turning point. Let's zoom in on a critical moment, October 1885. Freud, then a 29-year-old neurologist with modest means, receives a career-defining opportunity, a 6-month travel grant from the University of Vienna's Jubiläumsfonds. This was a scholarship for promising but financially struggling researchers, and Freud was one of its recipients. His mission? To study neuropathology abroad. But here's where things get interesting. Vienna expected him to go to Berlin, the epicenter of Germanic medical science. Instead, Freud hesitated. Why? Because Berlin's approach to mental illness, firmly rooted in biology, dismissed conditions like hysteria as mere female theatrics. Meanwhile, whispers from Paris spoke of Jean-Martin Charcot, a towering figure at the Salpêtrière Hospital, who was using hypnosis to treat hysterical paralysis. For Freud, this wasn't just a choice between two cities, it was a choice between two visions of the mind. The Hamburg detour, Dr. Eisenlaw's role. Before settling on Paris, Freud made a little-known stop in Hamburg. There, he met Dr. Eisenlaw, a name now lost to history, but who played a brief yet crucial role. Eisenlaw introduced Freud to patients with hysteria, but what Freud witnessed left him unsettled. These patients exhibited symptoms that defied anatomy, like glove anesthesia, where numbness stopped neatly at the wrist, as if drawn by a line. Yet, instead of curiosity, Freud saw his colleagues dismiss these cases as faking. This was his first real encounter with medicine's bias against mental illness, and it planted a seed of doubt. Was the brain really the only key to understanding these conditions? Or was there something deeper, something psychological at play? In his grant report, later volume 1 of his collected works, Freud justified the pivot. I resolved to study neuropathology at Paris's Salpêtrière Hospital. Vienna's scattered knowledge coalesced there, and above all, there was Charcot, whose 17-year reign had redefined neurology. Having trained under giants like Theodor Meinert and Hermann Notnagel, I expected little new from German universities. But French neuropathology? That promised revelations. Note the diplomatic tightrope. Freud's German benefactors expected Berlin. His report reads like an apology: yes, Vienna's professors are peerless, but France offers what Germany lacks. he name-drops mentors like Notnagel, internist, famed for discovering atrial fibrillation, and Maynard, hardcore neuroanatomist who sliced brains of schizophrenics, seeking physical proof of madness. These nods subtly assert, I'm no renegade, just expanding horizons. Here's the tension: Freud's grant was for neuropathology in microscopes, autopsies, tissue stains. Not talk therapy. Berlin's medicine was staunchly organic, hysteria was dismissed as sham illness. Paris, though? Charcot staged public hypnosis spectacles, insisting hysteria was real. Maynard scoffed, all mental illness has brain lesions. Freud, mentored by physiologist Ernst von Bruck, gambled on Paris. The rest? History. Picture this, an 800-year-old labyrinth of buildings in Paris, their soot-stained walls once crammed with gunpowder, saltpeter in French, potassium nitrate to chemists. By 1813, Napoleon's army had repurposed it into a hospice for vieilles femmes, elderly, destitute, and imad women tossed aside by society. Yet by the time Freud arrived in October 1885, the Salpêtrière had morphed into something extraordinary, the world's premier neurology hospital, thanks to one man, Jean-Martin Charcot. In his meticulously detailed report, which reads like a 19th-century travelogue, Freud describes the Salpêtrière as a vast complex of two-story buildings with austere facades, courtyards, and gardens, reminiscent of Vienna's General Hospital. Was this nostalgia? Or strategic flattery for his Viennese benefactors? Either way, Freud's awe is palpable. From gunpowder to hysteria. The Salpêtrière's very name betrays its origins, a saltpeter depot for manufacturing artillery. But Charcot, a man so determined to revolutionize neurology that he worked unpaid for 12 years, transformed it into a temple of science. By 1881, he'd secured the chair of neuropathology, turning its wards into a living laboratory. Freud notes, before his professorship, Charcot came daily at his own expense, lecturing, consulting, and mentoring, until the institution became unrecognizable from its past. The theater of madness. The heart of Charcot's empire? The Tuesday lessons. In the grand amphitheater, assistants like Joseph Babinski would parade patients, epileptics, hysterics, paralytics, before a rapt audience. Without preparation, Charcot would dissect their symptoms in real time, dictating notes to scribes. Freud, translating these sessions later, marveled at his lightning-fast diagnoses, photographic memory, and almost theatrical flair. Freud's unrequited hero worship. Charcot's magnetism left Freud starstruck. In letters, he confesses longing for Charcot to kiss his forehead as a token of approval, a gesture never bestowed. Yet Charcot did gift him a signed portrait in February 1886, now displayed in Vienna's Freud Museum. A relic of the master who, as the French boasted, was the greatest neurologist alive, though Germans sniffed, greatest French neurologist, perhaps. Here, amid the Salpêtrière's crumbling grandeur, Freud's German rigidities collided with French experimentalism. Charcot's hypnotized hysterics, writhing under trance, forced a reckoning. What if mental illness wasn't just brain lesions, as Maynard insisted? The seeds of psychoanalysis were sown in this very dissonance. Charcot's multidisciplinary legacy, from neurology to the birth of psychoanalysis. The anatomical titan Charcot's name is etched across medicine. Consider Charcot's artery, the lenticulostriate artery, a tiny but critical vessel whose blockage triggers lacunar strokes. Or Charcot's joint, neuropathic arthropathy, where diabetic patients, devoid of pain sensation, endure grotesque joint deformities from repeated trauma. These are not relics of the past, they're clinical realities you'll encounter today. His eponyms stretch further. Charcot-Marie tooth disease, a hereditary neuropathy. Amyotrophic lateral sclerosis, ALS, still called La maladie de Charcot in France. Charcot-Bouchard aneurysms, those deadly microaneurysms in hypertensive brains. Charcot's triad, fever, jaundice, right upper quadrant pain, in cholangitis. Charcot's neurologic triad, nystagmus, intention tremor, scanning speech, in multiple sclerosis. Even Charcot-Leyden crystals, eosinophil remnants in asthma or parasitic infections. This wasn't just productivity, it was synergy. Charcot assembled a cadre of prodigies, Pierre-Marie Babinski, Gilles de la Tourette, and Alfred Binet, yes, the IQ test pioneer. He credited them, even when he could have claimed glory. Tourette syndrome? Charcot insisted it bear his protégé's name, not his own. The psychiatric blind spot that shaped Freud, yet historians note a paradox. Charcot, the neurologist extraordinaire, was oddly clumsy in psychiatry. His interviews lacked depth, he misdiagnosed hysterics, he clung to outdated somatic theories. But this very gap created an opening. Charcot's clinic became a magnet for those obsessed with the mind: Freud, Pierre Janet, William James. Imagine a 19th century lab where Tourette's, IQ tests, and Freud's theories were all incubating. That was Charcot's classroom. Today, we dissect his legacy through 7 revolutionary disciples, and why Freud was just one thread in this tapestry. The protégés, Charcot's living legacy. 1. Joseph Babinski, the neurologist who revolutionized diagnostics with his iconic Babinski reflex test, exposing hidden brain injuries through a simple stroke of the foot. 2. Pierre Janet, the forgotten pioneer of dissociation theory who mapped traumatic memory decades before modern psychology caught up. 3. William James, the philosopher-psychologist who turned Charcot's hysterics into groundbreaking theories about consciousness and human experience. 4. Pierre-Marie, the endocrinology trailblazer who proved pituitary tumors could alter both body and mind. 5. Charles-Joseph Bouchard, the cerebrovascular detective whose aneurysm research taught Freud the difference between brain lesions and psychological wounds. 6. Georges Gilles de la Tourette, the defiant clinician who fought to prove involuntary tics were neurological, not hysterical theatrics. 7. Alfred Binet, the IQ test inventor whose work on measurable intelligence unexpectedly shaped Freud's theories of the unconscious mind. The crucible of hysteria, Charcot's laboratory. Freud arrives in Paris on a bursary for neuropathology, only to encounter an eerie coincidence: the death of Joseph Babinski, a former patient of Jean-Martin Charcot, now a pivotal figure in psychopathology and psychotherapy. Charcot, with macabre efficiency, hands Freud the corpse, instructing him to conduct a full autopsy. Thus begins Freud's gruesome apprenticeship, dissecting brains, slicing tissue, and cataloguing specimens. Yet, his heart isn't in it. Only one paper emerges from this grisly work, a study on the medulla oblongata, but Freud's gaze is already fixed on Charcot's true obsession, hysteria. Charcot, the towering neurologist of Salpêtrière Hospital, believed neuroanatomy had reached its zenith. Major pathways were mapped, syndromes catalogued. But hysteria defied logic. Patients presented with bizarre symptoms: paralysis without lesions, seizures without epilepsy, blindness without ocular damage. Charcot's team autopsied brains relentlessly, yet found nothing. The enigma consumed him. The theater of hysteria, photography as science. Charcot's masterstroke? The Iconographie photographique de la Salpêtrière, a photographic archive of hysteria's theatrics. In an era when cameras required minutes per exposure, Charcot commissioned a custom rig of 12 synchronized lenses to capture hysterical fits frame by frame. The result? A chilling gallery of contortions, women arched in archi-encircle postures, limbs locked in contractures, faces twisted in pseudo-epileptic agony. Enter Augustine, the 19-year-old star of this archive. Hundreds of photos document her cycles of ecstasy, paralysis, and eroticized swoons. Rumors swirl, was Charcot in love with her? Did Augustine perform symptoms to hold his attention? The film Augustine, 2013, dramatizes this fraught dynamic, hinting at the blurred line between clinician and voyeur. Critics later argued hysteria was iatrogenic, a product of the doctor's obsession. As one historian notes, Charcot didn't discover hysteria, he invented it. Charcot's legacy, breaking dogma. 3 radical insights emerged. 1. Hysteria not equal to uterus. The term hysteria, from Greek hystera, womb, was archaic. Charcot proved symptoms bore no link to genital pathology. 2. A male hysteria exists. When Charcot exhibited male cases, skeptics laughed. Yet his work normalized the idea that conversion disorder transcends gender. 3. Trauma as trigger. Charcot coined agents provocateurs, external shocks, war, abuse, alcoholism, that unmasked a hereditary neuropathic predisposition. Freud would later invert this. Trauma wasn't just a trigger, it was the cause. Freud's epiphany. Freud left Paris haunted. If hysteria wasn't organic, what was its source? The answer, buried in Charcot's unresolved questions, would ignite psychoanalysis. When Freud returned from Paris, his mind remained electrified by Charcot's demonstrations. Though he never met Augustine, the iconic hysteric of Salpêtrière, he voraciously studied her case reports. This intellectual ferment culminated in his 1886 manuscript Vergleichung der hysterischen mit der organischen Symptomatologie, Comparison of Hysterical and Organic Symptomatology, a text so revolutionary it wouldn't see publication until 1893. To this day, historians puzzle over Freud's 7-year silence, but when you read this text, available in the standard edition, you'll understand why contemporary neurologists still assign it to trainees. The anatomical conundrum. Freud begins with a clinical dichotomy familiar to any 19th-century neurologist: projection paralysis, peripheral damage to anterior horn cells, e.g., polio, causing segmental motor deficits, representation paralysis, central cortical lesions, e.g., stroke, producing topographical impairment. Here's where Freud's genius erupts. Drawing on Golgi, Kajal, and Kolliker's neuron theory, which revealed synaptic discontinuities in neural pathways, he notes a glaring anomaly: hysterical paralysis obeys neither pattern. 3 violations of neuroanatomy. 1. Absolute yet limited deficits. Organic paralysis follows strict rules. Peripheral lesions cause focal deficits, e.g., radial nerve injury, wrist drop. Central lesions create graded impairments, e.g., hemiparesis worsening distally. Yet hysterics present both complete paralysis and strict localization, e.g., entire arm paralyzed but shoulder intact, a biological impossibility. 2. Selective functional loss. Patients exhibit baffling dissociations, unable to grasp a cup but can write, forgetting only food-related words while fluently speaking other categories, blind to objects but perceiving colors. Such category-specific deficits defy all known sensory pathways. 3. Non-anatomical sensory zones. Hysterical anesthesia, sharply demarcated borders, e.g., glove and stocking distribution, paradoxical preservation, feeling pinpricks but not cotton, contradictory hemifield losses in cortical blindness. The Charcot-Freud schism. Charcot clung to organic theories, transient ischemia, vasomotor dysfunction, but Freud dismantled these. If vascular insufficiency explained hysteria, why don't symptoms respect vascular territories? Why does paralysis jump from limb to eye without anatomical logic? The epistemological breakthrough here, in 1886, psychoanalysis stirs. Hysteria ignores anatomy because it operates at the level of Vorstellung, mental representation. Pierre Janet's insight resonates: the lesion is in the idea, not the body. This conceptual shift, from nerves to meaning, would fuel Freud's later theories of repression and conversion. The scientific breakthrough. Freud's key realizations. Symptoms obeyed mental representation, not anatomy. Pierre Janet's concept, the lesion is in the idea. Laid foundation for repression theory. Conversion disorder. Psychosomatic medicine. Why this matters today. Enduring lessons. 1. Medicine must account for meaning, not just mechanics. 2. Some conditions require psychological frameworks. 3. Freud's courage to challenge biological dogma.